Good morning. Today I am going to talk about dermal puncture. This is Dr. Tariq uh, talking about dermal puncture today. The area that we want to do dermal puncture is should be warm. If it is not warm, then we should warm the site. Warming the site increases the circulation. Site can also be warmed by simple towel or washcloth, but the site should be completely dry before puncture, as residual water will cause hemolysis and dilution of the specimen. Commercial packs are also available. They should be wrapped in a dry towel and they should be activated by squeezing the pack. The temperature of the device should not be more than 42 degrees centigrade, and it should not be applied for more than 3 to 5 minutes. Dermal puncture should be done on the warm, healthy skin that is free of cuts, scars, bruises, and rashes. Deep puncture cause osteochondritis or osteomyelitis, which are dangerous bone infection. Avoid skin that is calloused, where there is callus formation, that is burned, that is infected, or that is bruised, edematous, or bluish. Avoid all puncture site and sites where circulation or lymphatic drainage is compromised. All these sites should be avoided. Now the depth and the width of the puncture. What should be the depth? Ideal depth, and what should be the width of the dermal puncture. In adults, it should not be more than 3 millimeter in depth, and if we are doing on the heel, then it should not be more than 2 millimeter, because this is very close to the calcaneus bone. This area heel is very close to the calcaneus bone. And for premature children, it should not be more than 0.65 millimeter to 0.85 millimeter. And the width of the puncture should not be more than 2.4, not 2 millimeter, 2.4 millimeter. The puncture should be made perpendicular to the fingerprints, not in the line of the fingerprint. This is perpendicular, this is in line. If we make in line, the water will flow between the lines and a nice drop will not be formed. But if we cut perpendicular, more capillaries will be cut, a drop will come out, and it will bleed more than if we cut parallel. Now the site of the dermal puncture. What should be site? Where we should do the dermal puncture? We should, in adults, we do on the hands. The middle finger and the ring finger are the ideals. The palmar surface, the palmar surface of the palmar surface of the middle finger and the ring finger. These fingers, these are the ideal for dermal puncture. We do not do on the index finger because index finger contains too many nerves, so it is very painful to do on the index finger. We do not do on the thumb because thumb is callous. Usually the puncture side is callous, and we do not do on the pinky because it contains too less tissue for a safe puncture. So we should do this puncture not in the center, because if we do in the center, it will contain definitely some water which will dilute the blood and disturb the result. So we should not do either on the tip or on the side, because here the tissue is too less. So we should do in between the center and little off the center. Little finger is too less tissue for a safe puncture, so there are chances of osteomyelitis and osteochondritis. Finger, thumb we do not use because it can injury site can be calloused, and index finger we don't do, it is very painful, and middle two finger they are the ideal one. Now dermal puncture of the infant. For children under 1 year, there is too little tissue available in any of the fingers, so dermal puncture is performed in the heel. In the heel, a medial and lateral borders of the heel are used. The plantar surface of the foot. This is the plantar surface. So make two lines here, this border and this border. The two red lines. This area can be used for dermal puncture in infants under 1 year. We do not do this in the center because, or back, this one back and this is center of this heel, because these both these areas are very close to the calcaneus bone and there are chances for osteomyelitis. We do not do in the arc because this arc is very close to tendon and nerves, so it can be very painful, it can be damaging the pains, the nerves as well as the tendons. But if this area is not available for dermal puncture, then big toe is an option. So we can do this on the big toe. Repeating once again, the depth should not be more than 3 millimeter in adults. But if we are doing in the heel of the adult, it should not be more than 2 millimeter because calcaneus bone is very near to surface. And in premature infant, it should not be more than 0.65 to 0.85 millimeter, and width should not be 2.4 millimeter, not 2, 2.4 millimeter. The depth, actually width is more important than the depth because uh, capillaries are superficial, just lying under the skin, and we make wider cut, then more capillaries are cut and there more blood will bleed and we will get a good drop. And we do not do in the arc of the foot here because it is there are too many tendons and too many nerves. We do not do here in the center of the heel or back of the heel because there are too many, it is very close to the calcaneus bone. And we do not do in the index finger because it is very painful, it contains numerous nerves. We do not use thumb because injury site can be callous. So we do not do use little finger because there is very little tissue. So the middle finger and ring finger, the plantar surface of the digital of the last terminal digit of the middle and ring finger, that are the ideal. This one, these two, they are the ideal. So thank you very much. Have a good day.